On January 10th, 2020, the genome of SARS-CoV-2 was decoded just a few weeks after the first cases were observed in Wuhan and only then reported to the World Health Organization. Even before SARS-CoV-2 had escaped from the genetic engineering laboratory in Wuhan, the German government felt a visionary urge to amend the LAG 1952. This text represents the legislative amendment and a reinterpretation or re-evaluation of terms such as war victims and vaccine-injured persons. On September the 12th in 2019, just in time 2 months before the release of SARS-CoV-2, the EU Commission and the WHO hosted a global vaccination summit. In their declaration, they instructed world leaders on how the 10 Commandment program must be implemented in the event of a pandemic outbreak. A globally agreed approach by all states. First commandment for vaccination readiness is promote global political leadership and commitment to vaccination and the building of effective collaboration and partnerships at international, national, regional and local levels with health authorities, health professionals, civil society, communities, scientists and industry to protect all people everywhere through sustained high vaccination coverage. All countries must have national vaccination strategies that marginalize no one. This sounds humanitarian, but in reality, the face behind this agenda is called totalitarianism. Surveillance systems must be installed to indicate diseases that are preventable through vaccination. While the first 3 commandments oblige the world's governments, the 4th commandment is intended to ensure that as many individuals as possible are convinced through vaccination propaganda. Combat as many critics of vaccination measures as possible. The following commandments serve the implementation of the first 4 commandments, made possible by continuous technological improvement. Use digital technologies to improve the monitoring of the performance of vaccination programs. Let research institutions test the efficacy and safety of vaccines and assess their impact on the respective vaccination program. Invest in improving vaccines. Avoid vaccine shortages by having the government monitor production processes. It is therefore a matter of making perfect use of the just-in-time principle, ensuring no capacity goes unused. Cross-media vaccination propaganda. Cancel heretical misinformation about vaccines for SARS-CoV-2 or alternatives to immunological defense against this virus. Empower health professionals at all levels, as well as the media, to combat effective, transparent and objective information to the public, including through collaboration with social media platforms and technology companies. Integrate vaccination into global health and development plans and align it with them within the framework of a renewed immunization agenda 2030.